And as always, just some webinar protocols. Laura, you can hit the next slide. So everyone, please know that this meeting is being recorded. And if you do not consent to being recorded, you're asked to drop off the meeting at this time. So thank you for your understanding and cooperation. And then we'll go into the next slide. So as I mentioned, this is our last session of the 2023 Maternal Health Tribal Learning Community Series. And maybe this is your first time, so just a quick background of who I am. My name is ٰ€Ṭsi Ꭰန့ì, and I am Navajo from New Mexico, and I work at the National Indian Health Board as one of the public health project coordinators. And also on this call is I want to introduce everyone to Dr. Lori Garg. She's our new maternal child health programs director here at NIHB, and she recently joined our team earlier this month. So we're excited to have her with us. And if I pause, that means I'm just admitting people as I go. And we can go to the next slide, Lori. Let's see. Yes, okay. So, and just a brief background of our intent with the Maternal Health Tribal Learning Community Series, as I explained, it's really was to create a space to learn and connect with one another. As we know, advancing maternal health outcomes in tribal communities can be a complex issue, and there's different ways to advance maternal health outcomes and what that looks like in different communities. And so we're very honored to be partnering with this initiative with our CDC partners, and we can't believe how fast it went by. And I'm really grateful to be co-leading with my different team members, Liv, and she's not able to join us today, but she's was very helpful, and I'm very grateful to be in this space and building up these new connections and meeting new different people, learning what people are doing across Indian country. And we gotten a lot of positive feedback based on our evaluations. So thank you for everyone taking the time to do that. And this wouldn't be possible without everyone's participation and feedback. So I'm grateful, and I learned so much, and I hope everyone has as well. And the next slide, so just some quick reminders that, as always, within 1 week, we'll be sending out today's recording and along with the presentation slides. And onto today's agenda. So I'll be highlighting some resources with the Hear Her campaign, and followed by our wonderful presenters today, Dr. Melissa Lewis and Kathy Sierra, who will share their experience and expertise with the Little Cherokee Seeds program, as this session will focus on exploring actionable steps and highlighting community-based and culturally grounded approaches for improving maternal and child health outcomes in tribal communities. And we'll have time for a question and answer session. And as always, just sharing a space for any follow-up discussion questions and any small group discussions anyone would like to share more additional ideas and their experiences. And then we'll also include the evaluation link in our follow-up email. So before moving to our presentation today, go ahead, next slide, Lori. Highlighting the maternal health resources with the CDC Hear Her campaign, which is really about raising awareness of urgent maternal health warning signs during and after pregnancy to prevent pregnancy-related deaths by sharing these life-saving messages about the urgent maternal warning signs. And as a proud partner with the CDC Hear Her campaign initiative, we just want to take a minute to ensure everyone that to utilize us as a resource when it comes to how to access these and learn more about the different resources that are available on the CDC Hear Her webpage. And we'll drop the link here soon in the chat. But, you know, throughout the series, we learned different ways to advancing maternal health outcomes for tribal communities. And one way that's building up health education awareness when it comes to learning more about what urgent maternal health warning signs look like and preventing pregnancy-related deaths in our tribal communities, whether that's sharing out these resources with your own family members or tribal community members. So we look forward to working with organizations or tribal populations in learning more about the resources that are available. And the next slide just highlights our upcoming Maternal Health Promotion Institute. If everyone isn't tired of us yet, please join us on August 8th and 9th. And I'm really excited to continue building up this community here and learning more from each of you. And just as a free virtual event, so the purpose here is to share culturally centered practices and strength-based approaches, and sharing equitable solutions that are making a positive impact on the health and well-being of Native families, children, and communities. And we'll also be sharing the link here soon in the chat to register if you haven't already. Okay, I think I covered everything, so I'll move on to our speaker introductions. And it is an honor to introduce both Dr. Melissa Lewis and Kathy Sierra from the Little Cherokee Seeds program. And the Little Cherokee Seeds program is a language and cultural immersion program for Cherokee infants and their mothers, and that this program was created through the knowledge and experience of Cherokee elders and speakers using Cherokee values. And therefore, the program curriculum centers around everyday living experiences in a home environment, focusing on seasonal traditional Cherokee activities. And Dr. Melissa Lewis is an associate professor of family and community medicine at the University of Missouri School of Medicine and a citizen of the Cherokee Nation. And Dr. Lewis works with the Cherokee community members to create and evaluate culturally based programs and interventions. And Kathy Sierra is a citizen of the Cherokee Nation, a first language Cherokee speaker, and has worked with the Cherokee language for the last 25 years. She is one of the lead teachers for the Little Cherokee Seeds program. And she was born in the Bell community in Northeastern Oklahoma, where her mother was born and raised. And her hobbies include working with plants and making jewelry from hand-rolled and fired clay beads. Now, I'll turn it over to them for their presentation. Thank you, everyone.
Sionagad.
Sio.
Thank you all for having us. We are very honored to be here today, and we are going to share with you a little bit about our program, the story of our program, and then a little bit about the research. We are here actually in about Park Hill, Oklahoma. It's about 30 minutes from Tahlequah. We're at a 260-acre campsite, so you might hear some other campers making some noise. We're also having a thunderstorm, so please let us know if there's any internet issues. Just jump on and let us know. Can y'all see the screen okay?
It looks perfect.
Okay, we'll go ahead and get started. Let me move this for you, Kayla, so we can see a little better. There we go.
Hello, everyone. As she said, my name is Kathy. My Cherokee name, Kelet Dawato. This is our motto that you see on the screen. I don't want to just create Cherokee speakers. I want to create Cherokees. One of the lead teachers that we have here spoke this at one time, and we all agree that's exactly what we want to do. And that is what we are trying to do at this time. We started this program back in November with our 5 mothers and 5 babies. But let me tell you where it all started was back in 2018. There was Melissa Lewis needed a place. Dr. Melissa Lewis needed a place wanted to take her son to learn Cherokee. Well, you know, it was very hard to find someone. Well, there was no one to really take him and just so he could hear the language. And so she herself took it upon herself and brought us speakers together and asked us to do like a Cherokee storytelling hour for children. And so she we all got together and started doing those storytelling hours, like every week at different communities. And we started with the Ꭰහන්<silence> community, which is a few miles from here, with maybe 30 miles from where we're at today. It was called Ꭰහන්<silence>, Oklahoma. And we started there, and we would bring in weekly kids to the library, and we would just do everything in Cherokee, speaking Cherokee, telling stories in Cherokee, doing everything that we thought the kids would like to hear and understand, or understand easier. So we did that for like 3 years, and then COVID hit. And this is like a day of 1 hour of doing this. These are the slides that we had of some of the days that we were, or evenings that we were doing this. And we did little projects, like even when COVID hit, we were trying to do the Zoom classes, and you see the blackberry bushes there. That was probably a picture from my field. I would walk around the field just talking to them in Cherokee, telling them about the blackberries are done, or they're getting ready to pick, and then I'd have animals, and I'd show them the horses the horse that I had at that time, and the cows and chickens, just anything to be talking to them in Cherokee. That is it. And I forgot to mention that my first language was Cherokee, and so the Cherokee, well, I don't know. I'm thinking too fast, because as a first language speaker, I know the only way a person can fluently learn the Cherokee language is to be brought into your homes, or you're born in it. You're born into the Cherokee language. And that's how I learned, because my parents spoke to me in Cherokee. I went to school first grade and didn't know a word of English, but somehow I learned it, and I remember speaking it when I was in 3rd grade. I don't remember who taught me, how I learned the English language, because I just know I spoke Cherokee one day, and then my mind tells me I had learned the English language. And I was in 3rd grade in Muskogee, Oklahoma, when all these thoughts came back to me, is where I had learned that language. And anyway, I had been born in Bell Community, and it was a very Cherokee community, and a lot of people, all my kinfolk lived there. And then when my mom married my dad, they had moved to Muskogee, and I was already like four years old. And whenever I got there, I did go to school, but it was an English world then. There was no Cherokee then either, nowhere that they could find. So I had to go into the English school. And so when I learned that, well, that's, that was it. Everything went to English. And so to come back to my kids, that is what we all thought about whenever Melissa and then COVID hit and we couldn't really do classes. That's what we started thinking about, was how can we teach kids the language and do it properly, and trying to do it where they could speak fluently, not just words and phrases. We want to bring everything that we knew growing up to these babies. So we started doing some classes, and we have one here that y'all can hear of a little puppet that we do in.
Ꭰᔅ히히가 Ꭰ스히히가 오스타 디지오 Ꭰ스히히가 Ꭰ스히히가.
So you see, you know, kids love puppets, and we thought that was a good, one of the good things to, you know, to do for our babies. But so we come to thinking about this. Well, Melissa says, what do you think we ought to do? And so that's what we started thinking and just saying, we need a house where we can go and just start talking Cherokee to the little babies. And lo and behold, Melissa found a grant to get us started doing just exactly that. And that's where we are today, is we started back in November with our mamas and babies. We got our grant in July. We put out the word that we needed mamas to participate in this program with their 6-month or younger babies, and that's what we selected, was starting from there. And it's been and we decided that we needed to just speak like we are everyday living, you know, going into the home and just talking about, are you hungry? What do you want to cook today? What are we going to do today? Because we want to get out there and look for those wild onions and cook them and teach the mamas how to cook them. And because, you know, it's part of our culture. They need to know all the stuff that we have done, or I have done in my past, what my mama taught me, you know. And so that's the things that now that we're trying to build our curriculum on, is just talking daily, you know, to our babies about everything in life that we do, you know, every minute of the day, you know. That's what we have been doing since November. And our babies are all over a year old. We've been at this since November. What is that, 7-8 months? And they are all are making sounds of the Cherokee language, you know. And we are so proud. Every day we hear something new, and we are just elated. We all just, you know, just elated all day long, and just thinking, this is going to work. You know, this is our passion, and this is what we're going to do, and this is what this is exactly what we think will work. So every day we find something that the kids might be interested in, or not really just because they're babies, you know, but the mamas. Like my biography, I put down that I do the clay beads. I make them from the clay, but I buy commercial clay because it's too hard to go find the other clay. And that's what I use. I do the jewelry, and so does one of my coworkers. She does the jewelry made out of the clay beads. So we've taught the mamas how to do that, and how to fire them, and make them where they are ready to make jewelry with. And then, of course, a couple of the coworkers know how to do the baskets, and we've been teaching them how to do baskets. And in fact, we've been doing quilting, because, you know, my mama did quilting a lot, and we started on that. And sewing, just making. Like one of the coworkers does ribbon skirts, and so he was teaching them how to do all that, and anything that we can find. And we even bring people from the community that you know, that are speakers, that can come in and bring us like Cherokee activities, like marbles. Cherokees loved marbles back in the day, and we have a speaker that does that, and we want to bring him in and show the mamas all that too. But in the meantime, the mamas or the babies are there listening to every word, watching everything that we do, And so it gives us a feeling that they will know this, you know, as they get older. And because, you know, they just like sponges, they just take everything in, and they just know, I just love it because they'll just sit around or they'll walk around while we're doing crafts, and you know, they just it just, to me, it feels like that is what is in my heart, is for them to learn all this. And let's see, so we've tried to increase the mama's knowledges in all the things that we're doing. So so you see this method that we are trying to do every day, daily. And that is the family environment. I believe we are a family here. We've done, you know, I'm close to those babies just like any other mama is, you know, because I see them every day. I take care of them. I put them to sleep. I feed them. I do whatever a grandma does. And I have 8 grandchildren, so 5 more is good. You know, I love it, but it just gives me hope, you know, that we are going to introduce, or we are going to teach these babies Cherokee, and they are going to be Cherokee citizens. So that is,
should we talk about maybe just, I think Kayla talked about this, but just so you all are familiar, I know a lot of Indigenous languages are at a really critical place, and the Cherokee languages too. It seems like a lot, but we have around 1,400 fluent speakers. 90% or so are probably over the age of 65 and 70.
mm-hmm.
And so during the pandemic, when we switched from in-person language classes for the babies and infants to online, then we kind of took a step back, and the fluent speakers, there were 3 at that time, sort of said, okay, we've lost up to almost 300 fluent Cherokee speakers during the pandemic. The majority of our fluent speakers are over the age of 70, and we are not creating any new fluent speakers. We need to do something different. And what should we do? And the speakers started talking about how they were raised, like Kathy was, how they learned the language. And many fluent speakers went to an English-only school or went to a boarding school. And in our group, people went to that school around 4 or 5. Jagu, 4, as early as 4. So because of that, we're not really using Western developmental milestones, but we're using our own personal milestones, the speaker's personal milestones, and what they know about the Cherokee language. And which is, if we can get a child of 5 years old being in a home environment, we can create a fluent speaker again, and our language can live another generation, another 75 years. Because right now, just before November, there wasn't, it didn't feel like there was hope that could happen, that a fluent speaker could be created, because in a classroom setting, it has not been effective thus far. It's a class 4 level difficulty, UNESCO designated class 4 difficulty level 4 difficulty language. It's extremely difficult to learn. Even after 2 years, second language learners are kind of at a low conversational level, from what I understand. So that's just a little bit of background of why it felt really important, and why Kalot and the other speakers, you know, they use their own knowledge about their own development to create this program. And it's kind of like an anti-curriculum. And so some of the things that we don't do is we don't have teaching materials, books, coloring pages. We're not going to teach the written language. We want it to be like going to grandma's or to auntie's house. We want them to learn just like the speakers learned. And so we live and work together in a small community. We cook together, we garden together, we clean together. And then we have these additional Cherokee activities. We don't have, no screens are allowed, no plastic toys. We're at this camp. Our goal is to be primarily outdoors. So we start to kind of connect with our surroundings as well. Health is very important. We started in November, which was hard to make traditional Cherokee foods because we didn't have a garden yet. But we do daily home cooked meals. They're high in vegetables, fruits, whole grains, and legumes. We do now have a food garden, a medicine garden, and we're working on having an outdoor kitchen, although we cook outdoors anyways. Just find some braided metal and
we just build that fire and put it on.
Yeah. And we're hoping to do foraging, hunting, and fishing as well coming up now that it's kind of gotten a little warmer. But we also every week have a guest fluent speaker. So they will teach to the moms. So the moms, our goal, we are really not sure. There's never been like a 2 to 3 year, this is a 3-year program, but a 2 to 3 year time when someone's been immersed in a natural learning environment, not where they're working on the classroom. We don't know how much language they'll learn. We do strongly believe that the children will be able to be conversationally fluent based on our personal experiences. But for the moms, we want them to learn to, that we have these guest speakers to come and they're here weekly and we focus on seasonal activities. So, what would Kathy's mom and grandma and aunts and uncles and grandpa be doing each season? So we cooked squirrel last week. This week we're planting corn. And so we're, I kind of see these moms like we are giving them the skills to be Cherokee community leaders. And as we were getting started, we started learning about traditional Cherokee plants like chinkapins and pawpaws. We went to see folks in the Eastern Band and learned about traditional gardening. We went to outdoor Waldorf school. So this was kind of how we decided to learn. It wasn't really, when we still haven't done any like Western child developmental training. This is really a culture as intervention and leaning on Cherokee traditional knowledge about mothering, about child rearing. And when these guest speakers come, we kind of have a journal that we keep. So we can have kind of a list of what we're supposed to do as Cherokee women for these different times of our life, being pregnant, having a baby, birthing, and after. So we can start to compile and revitalize that knowledge too. I did mention we are a program of the American Indian Resource Center. It's been, I think this week, it'll actually, maybe even, I think this Thursday, it'll be 40 years. This nonprofit has been operating in Tahlequah, Oklahoma, run primarily by Cherokee women. So it was kind of a good fit that us group of women found this other group of women to kind of support us with hosting us. But they had acquired 260 acres. And we thought this was the perfect spot because a lot of Cherokee language and beliefs have to do with our relationship to land and water. So that's where we're physically located at Camp 7 Star. That's where we are right now. And I wanted to talk a little bit about, I don't know if you all have heard this term, like language is medicine, but as a second language learner, it is really amazing to me to hear that our language is just full of our Cherokee values. It's full of scientific knowledge. It's just chock full of all the things that we know that we want families to learn, and to really think about not learning the Cherokee language, how detrimental it is. It can be. So for example, and Kayla will be here to help me.
Yes.
So I just wanted to give some examples. So if I were to ask you how you're doing, one way of saying how are you is tohiju.
Tohiju. Osta.
And to say good.
Nihina.
Yeah. Os.
Yeah.
So the root you could kind of hear in tohiju is tohi. And it's this concept, this Cherokee concept of being balanced. So we're really asking, are you balanced? And so just in the very basic, even OCO is hello and OSTA is good. And the root of both of those words are OC, is this sense of balance, which we know is good for mental health, for our ecology, for families. So these are just like, I just wanted to share with you all just a very small bit of the language and how it affects how people see the world. One fluent speaker says, I could be sitting in a room and all of us are talking about a watermelon in English. And then like, if we decide to talk in Cherokee, all of a sudden he called it the Cherokee prism. He's like, the walls have changed, the earth has changed, everything has changed when we talk in Cherokee. And there's actually theories that demonstrate that the language that we use shapes the view we have of the world. And I guess that's what I'm trying to share. One of the theories is called the Sapir-Whorf hypothesis. And that's exactly it. And we believe strongly that the Cherokee language will put these mothers and their children on a healthy trajectory to be able to live more positively in this world.
Mm-hmm.
If you're ever around here, you hear the word gadugi a lot. It's a popular word, but it comes from, over here on the right, there's a list of Cherokee community values that came from a person who wrote them down was Benny Smith. But these are critical values about how Cherokees take care of each other, or how they used to.
Yes, how it used to be.
And
when we had a lot of Cherokee communities where people were always helping each other, and they had this balanced life in their own little communities. Yes. Go ahead.
Yeah, and that's why the speakers are here, because we know that's good for our communities. We know some of these, you can read them, but you all live helping one another, treat each other's existence as sacred. You all take responsibility for one another's well-beings. I think we could all probably agree what the world would be like if we all follow these. And even as Cherokees, like Kayla was saying, we've fallen away from these. But in this program, we know the language by itself will guide us there, let alone these amazing speakers who have lived it and are willing to teach and revitalize the language and these values.
Mm-hmm.
Oh, Dr. Lewis and Kathy, so there was a question. I wonder if we can wait maybe till the Q&A or as we're talking about this certain subject, but Fabricia, I believe that's how you pronounce your name, had two questions about the family structure and the other one about the written aspect of the language. I wonder if she can unmute.
Yeah, can you guys hear me?
Yes.
Yes.
Awesome, thank you. So my name is Fabricia. I am originally from the Amazon. And we also have a number of Native communities in the Amazon that there is a historical aspect of having the language wiped off by intentional programming from the government, in our history. So I can relate with living in a place where the language is being lost. So, but I do have a few questions that are helping me understand the values. One is about the family structure. So I live in South Dakota, and here in South Dakota, we have the Nakota, Lakota, and Dakota communities. And in those communities, the family structure is connected by your parents. So your mother's sisters are also your moms. Your father's brothers are also your fathers. The concept of uncles and aunties don't really make much sense in that context. You know what I mean? Even the words, the way they describe it, doesn't make much sense. So I was wondering if that is similar in Cherokee community. And also the other thing that I know, based on my experience in the Amazon, is that some of the languages that we lost because there wasn't any written records of them. They were just orally spoken. And some of the work that we have done in the Amazon with the native languages that still stand to this day is to develop a written vocabulary or have written text. Sometimes it is the Bible, sometimes it is other things, but having some kind of written document that you can refer to, that you use to teach, or the alphabet of that language. So I was wondering, you guys were talking about how you doing that in the day-by-day life, but I was wondering if that process you also teach the written language? Because my mother, for instance, she taught me how to read and write at home, and that really helped me. So I was wondering if you guys do something similar. So those are my two questions: the family structure and how that influences in the language, and how you guys are teaching the writing aspect of that to your kids too. Thank you.
Well, we haven't started yet teaching the babies, but we have the mothers. Yes, it's very important that they know that we have a written language, because even I'm not gonna lie to you, I never knew we had a written language in Cherokee, because I was never shown it in my school ever. And so I never learned it until I got around other speakers. One of the men encouraged me to learn it, and he gave me the alphabet, and he told me, this is what you need to learn. And, you know, my mama read it, but she didn't know how to write it because it was not taught, but her mama taught her how to read it. And, you know, you think if you could read it, you could write it, but that's not so. You know, it's not, because my mother's proof of that. And I always told her, Mama, why can't you write it? And she's like, I never learned, you know, but it was like, all we had to learn was the Bible, you know, in Cherokee. That's all we had in the Cherokee language. I don't know what happened to any of it that the schools used to have. You know, they do find pieces of books, and even some books, you know, that are, but they're in the museums. Who's going to use them there? Or my mama couldn't find that, you know. But anyway, yes, it's very, if I teach the language, that's the first thing I gave my students was the syllabary, because I wanted them to know that we have a written language. And that's hard to learn too, because we have like 80 something characters, but it can be done. I mean, you know, it can be done. So yes, I believe we have to have it, and we did introduce it. We have introduced it to the mamas, but like we said, we don't want to do pencil and paper. But we do want them to know there is, and that they will on their own start learning all that, you know. But we do spell out phrases, you know, whenever they want to know phrases, and we give them new phrases. We started doing a class at least 2 or 3 times a week, just the mamas, so that, you know, the babies, they'll come after that. But go ahead.
Share something.
Yes.
I think the Cherokee language is different than most.
Mm-hmm.
Can you see the written language right here? To, and then O-si. So this was invented around the 1810 by Sequoyah George Guess. So we were one of the earlier tribes to have a written language, and it was used all around the world. We had printing presses, we had typewriters. Cherokees have always been very well informed. At one point in time, Cherokees had the highest literacy rate of anywhere in the world, because most countries only would educate men, and Cherokees never did that. We've been educating our tribe with the written language since 1810. It's waned, but the written language is safe. What's not safe is how to have a conversation in Cherokee. So the program that we have, the babies are 0 to 3. So they don't need to learn the language at this time.
The syllabary.
The syllabary, the written language, I apologize. Right. So that's not, and in fact, it can hamper someone's ability to learn the language if you try to teach a written language too early. So that's something we had kind of decided that in this age group, we do want to keep them to 5. We don't have a grant to do that yet. But for 0 to 3, we really wanted to focus on speaking, because that's our kind of main issue. There's a lot of recordings. We have a lot of documents. But I guess, I wanted to say ants in the Cherokee language, it's either Klugi or ᎠHP. Ṭāṭli is second and ēji.
Mother, second mother.
Would you say ᎠHP?
ᎠHP.
So we have that same concept. But is it okay? We'll keep moving. Okay. Oh, we're going to a good place here. So here are some examples of the traditional foods that we eat. This is Georgia candy roaster squash. This is a squash that Cherokees cultivated. These are squirrels that y'all cooked up last week. Sangi enige ehi, wild onions and eggs. So they collected the onions themselves. These are kind of like cornbread, boiled cornbread. These are mushrooms. I think you brought them.
Mm-hmm.
And then kind of a mix of everything. So traditional foods and the food systems are a big part of our activities. And here's some other activities that they've learned to do, how to forage for the onions, how to make a medicine garden. What are our traditional medicines? Corn husk dolls, ribbon skirts. Here's the clay beads that Kayla was talking about. Dyeing reed to make baskets. I don't know why I don't have any baskets. They made hundreds of them. And then, going on daily walks to interact with the environment. And I think that's a locust shell or something, learning about bugs, and they've met a lot of snakes.
Mm-hmm. And a giant centipede. Did we take that?
That was awesome. Yeah. So to kind of switch gears from really just switching gears to the Western research that kind of backs up the traditional knowledge that these women live and breathe and do. A little bit of a literature review. So Native people that identify strongly and positively with their Native identity, and they take part in traditional cultural activities, have better grades and academic performance, better mental health, reduce substance use, and improve physical health. And that includes reduced smoking, obesity, and diabetes. And traditional cultural activities fosters a positive relationship with peers. Another program here at Cherokee Nation is called Remember the Removal. And this was a program that I learned about because it's just really popular. Everyone kind of knows about it. And everyone talks about how it's affected their lives.
Sincerely.
It's every single year. It started in '84, but it's gone on and off since then. It's pretty regular now. We partner with the Eastern Band. But I would say this program is an example of culture as prevention. Much like our program in 1984, parents got together and said they were worried about their children and they want them to learn Cherokee history and culture and language so that they could be community leaders. Actually, it sounds exactly like what we're doing. And so I was able to do focus groups with a recent cohort and also the '84 cohort. And I found amazing stories that they shared with us that it really changed their lives in all these realms of health and well-being. And so then we followed them with surveys every 6 months. And this is just a small kind of snippet of the results. T1 is the baseline to T2. So what they did is for 6 months, they learn Cherokee language, history, culture twice a week, and then they go on bicycle rides. And then they follow the removal route from Nõ'achoda, Georgia, our old capital. And they follow the removal route, that the northern one, to get to our current capital, Tahlequah, Oklahoma. And again, the whole time learning a kind of place-based knowledge, what happened in Ꭰлаг-ᎠHP, in the old home, and then what was the removal like? How did Cherokees get through it together? They had primary sources, some in Cherokee even. And, we found that when they finished the project, their mental health was statistically significantly improved. And I did a long 6-month follow-up, and most of them remained statistically significant. So this is a little bit of kind of the Western research foundation that we know the power of Cherokee culture and language on our young folks. And these were 18 to 24-year-olds. There's a lot going on here. I'll just highlight a few things, but there was a study done in 2016 that actually looked at traditional language use and the health and well-being of participants. They found in Canada that Indigenous language use reduced suicide rates. They found that in Australia and Hawaii, there was reduced alcohol and drug use in the language immersion schools in Hawaii compared to the non-native Hawaiian language immersion schools. There was statistically significantly more high school graduates. Physical health, in a few different tribes, they found that the tribes that used their language smoked less, they were in a better wellness categories, and even had lower rates of diabetes after controlling for socioeconomic factors. They redid this study, and I joined the crew last year, and they redid the study because there were so many more studies about language. And for this is sort of like a systematic review, looking at any article that talked about Indigenous language and had health and well-being. In the bottom, we even added education, and there's mental health, there's crime we added as well. And you can see that for each of the categories, blue means the language, Indigenous language use or revitalization of it was related to a positive outcome. Red is negative. And really, even with the red, they were kind of comparing studies in the English language. So they would say, they would do like reading or math scores, and it would be compared to Indigenous, children who had Indigenous languages as their first language versus those has English as first language. Excuse me. So the majority of the results found that Indigenous language use was related to positive health and well-being, especially, excuse me, the three that stick out are suicide, alcohol use, and mental health. So again, this is the Western research kind of catching up with the Cherokee or Indigenous knowledge. I also wanted to share something about mental health that I found that is really interesting. So I found that Americans are chronically deficient in micronutrients that are really important for positive health. For dopamine and serotonin, you need vitamin B, D, magnesium, and omega-3. And we are, each of those, again, there's chronically deficient. Omega-3s, I don't know how it's possible, but in a very large study of Americans, 100% were deficient in omega-3s. And if you look at the list of Cherokee foods and pre-colonial Indigenous diets, we are rich with all of these. So just another way to demonstrate that, we have a lot of, I guess you would call, active ingredients. We have community, we have language, we have food, we have physical movement. But each of these, even on their own, have kind of shown how they can positively affect the health and well-being of moms and babies and families and communities. And so these are the first 5 babies we started with, and then we need a picture with the two. We have 2 newborns.
We have 2 new ones.
Yeah. So we have 7 babies now, and we're just really excited for their future, and just really grateful that we have fluent speakers like ᎠLGBT and ᎠʰegyᎠ and ᎠʰegyᎠ and others that are willing to share what we know is going to be, it's going to be like medicine for these families. So I just wanted to kind of say wado, to say thank you to the American Indian Resource Center, our funder, the Administration of Native Americans. Cherokee Nation supports us, and we also have donors, supporters, and collaborators that we're very appreciative for.
Yes.
Anything else?
No. Thank you for having us.
Yeah, thank you all.
Yes, thank you guys. So I did save one question that we got during the presentation. So I'll go ahead and jump into sharing that. I'm trying to find it. I think it's by Luz. And they said, you mentioned how quickly the babies start making Cherokee sounds. How quickly do moms' Cherokee speaking skills improve?
They They are doing great. They try every day. I hear them speaking Cherokee every day to their babies, because we've encouraged them to do that every day, daily, and to take it home with them. We want them to do it at home too. So every little phrase that we teach them, they are trying.
So when there's a new activity, like we're doing beading today,
Mhm.
we'll record it, and then we'll have a keyword of all the, I don't even know what it would be, like pick the bead up with a needle or something like that. We'll have a list of all those. And so that's how they'll learn it. But it's a very different learning style than the babies.
Mhm.
They have immersion, natural immersion, but they also practice. And I think for a lot of second language learners with such a difficult language, immersion feels too challenging.
Mhm.
So we're kind of doing both.
Mhm.
Thank you. And Candy wrote, any similar programs for school age kids, or where do your families transition to? Thank you for the question, Candy.
Mhm.
So because we are sort of in this, honestly, a desperate position with our language, just getting this program started was a miracle. The goal, the speakers sort of say, if we can get them to 5 in this kind of program where they have 40 to 50 hours of language a week,
It will be here. It won't go away, because that's how I was. I mean, it's never gone away from me. And I learned it this way, with my family, with just being home, didn't go to school till I was 4 or 5. And it stayed with me. So this is what our hope is for our babies, is that if we can keep them till 5, that it will be here.
It doesn't matter where they go
Yeah.
next. Now there's amazing programs like at University of Hawaii, where they take the Native Hawaiian education from birth to a PhD. And of course that's a dream,
Mm-hmm.
but we just have to save our language right now. And so we are hoping we can add cohorts of additional babies. But we're just a group of moms and speakers, we got a lot of dreams, but of what things could be, but we're just a community group, really. So one huge dream at a time. And then the first one is to just keep our generation going, or keep our language going one more generation. Yeah,
we're just thankful that we got this started. We got this far, but we're just hoping for more. But but right now this is what we want to do.
Yeah. And we've been going about 6-7 months, so it's still kind of like we believe in our hearts that it'll work, but we just started. So we are just learning every day.
Thank you both. And a question on my end. So I know you mentioned the funding's coming from the American Indian Resource Center, and being a very successful program so far in my eyes too, and I'm sure everyone else can agree too. And I'm wondering if you guys have plans, or if there's room for collaboration with other programs housed under the American Indian Resource Center. If there's other language immersion programs too that are doing a similar project objectives. How does that look like as far as collaboration is what I'm.
Well, we have started collaborating with other language programs, some in New Mexico, some in Minnesota. There aren't very many programs where there is a parent with a child. And that was another part of just my personal experience, was that becoming a mom is really hard. And I didn't want to leave my child. And we know that the bond between mother and child, as well as fathers and other people, are very important. And most people have to go back to work after 4 to 6 weeks. We do pay the mothers to come here. And so we were very cognizant that we wanted to build these relationships and to have these strong family units. Cherokees are matrilineal, they're matriarchal. So if we're rebuilding And we're going back to our Cherokee ways of being. This is the first place to start with the newborns and the moms, and then build out. American Indian Resource Center serves 10,000 American Indians and the Cherokee Nation Reservation. Primarily, they do like culturally based education. So they're not working on they do Cherokee language, but they're not completely fluent. We are the only program that I know of that English is not allowed. We cannot use English here because there is so much English in these children's world anyways. Every single word that we use will set them up to be able to speak Cherokee or not. So it's really hard to sort of do like, after school programming for a couple hours and to become fluent. But we are collaborating and starting to learn about other programs that are doing language immersion. Yeah. Did that answer your question?
Yeah, and it kind of touches on someone else's question too, and you kind of spoke on it a little bit, was, are fathers/males involved at all?
They are supportive of the mothers and babies. The fathers we have, they are supporting. I don't know how much at home, but just for them to be able to come, I think is a lot of support.
We've seen they share videos, like every time a baby says a new word in Cherokee, they share they try to capture it, like your first steps, and the first time you said "gage" or "edgy" or something like that. And we get to see the dads talk to the babies in Cherokee too. So it's exactly what we had hoped. The moms are going home and they're asking family members to speak in Cherokee and teaching them. We do also ask that they spend 10 hours at home, either listening to Cherokee, maybe on a tape if they don't have a fluent speaker in the family, or spending time with a fluent speaker in the family. Many of them have lost that one person left in their family. And that's kind of the state of where these families are, and many of them are maternal figures, which is kind of a good fit to have these these second mothers in their lives, because most children here don't have a fluent speaker in their family anymore. So the dads are not a part of the program. Moms and babies come, but we have visions and goals and hopes for them as well. We think about ways we can support them in learning the language, support them in coming out, possibly making additional programs in the future. We're starting kind of with the core and trying to work out and expand as we have the capacity to do so.
Mm-hmm.
Yeah, and just want to encourage anyone, if you guys have questions, feel free to share it in the chat or in the Q&A box. That's what people have been doing. I can share it on your behalf, or unmute yourself. And I don't want to jump in and ask my question. So we have a question. Oh, go ahead.
I was just going to say, someone asked for our email addresses at the very beginning of the presentation, and I'll send it. We have a Facebook page. It's just Little Cherokee Seeds. But you can, find us there if you need to. But I can share emails as well.
Perfect. Yeah, we can put that in the follow-up email too, whatever is easier, so everyone has access to that. And a question on our end, like, what advice or insights would maybe you guys would like to offer for those who are interested in establishing a program like this?
Well, for one, you just gotta do it. That's all there is to it. You just got to do it. Melissa said, we're going to file for this grant, and if we get it, this is what we're going to do. And I said, get it, and I will quit my job and come work for you, because I know that's the only way for me to make Cherokee people. It is. It's really, I think, go for it.
Yeah, it's like we would be doing this whether or not we had a grant. We're lucky to have gotten a grant, but we started in 2018 teaching. So, and I heard the same thing about, and I need to double check this story, but the Native Hawaiian revitalization, from what I understand, started with parents and people that just really that cared about their children, and in a park bench, and the same thing with the Remember the Removal program. It's grassroots communities, it's parents, grandparents that care about their kids, and they're just going to do something about it. And as we just started because my baby was born and I wanted to learn the language, and there was people that cared so much about the next generation that we just started too. And we didn't really know what we're doing. We probably still don't know exactly what we're doing, but you just don't be afraid. Like in our hearts, we knew it was right. And we knew that we were at this crossroads, and can we live the rest of our lives knowing that we could have tried to save our language and didn't.
Right.
And so it's something that's in our hearts that's so important, and
we're just a small part trying to save our language. Yeah.
Yeah, I guess I'd also, I know many of you are probably working in like tribal health settings, and I've been in those settings as well, and you can't this program maybe doesn't translate as well, but it can, pieces of it can translate into clinics, bringing elders to clinics, having elders in residence, bringing culture into Western settings. I think something that we don't use the word decolonize a lot, but we've had to have conversations a lot about, this is how we grew up, and this was not the Cherokee way, and how do we make it the Cherokee way to do things, because we know that's the ᎠLGBT, the right way.
Yeah, the right way.
It's just getting together and about
every day we talk about, what are we going to do now? It's weekly, it's daily, it's what's the next step, but we're getting by, and we're doing it. So very proud of my coworkers. Yes.
Thank you both so much. It's obvious you guys are both doing the important work for your communities you're serving, and I really loved what you said is about language is medicine. Definitely believe that so strongly too. Coming from the Navajo language, it's different when you hear "I love you" in English and versus saying "I love you" in Navajo. So I truly believe language is what people say. Culture is prevention, language is prevention. And I liked what you also said about language is guiding us and teaching us a lot of stuff itself by just learning it. So again, just thank you guys so much for sharing your knowledge and expertise and your passion for doing this work. I feel it through the screen. So thank you guys for taking the time to be with us and hosting our last session with the Maternal Health Tribal Learning Community Series. And I'll be sure to send out everyone your guys' contact information in our post webinar email, and including presentation slides and the recording link. But if I want to open up if anyone else has anything else to share, but we'll also follow up with some resources as well and our upcoming event in August. And we look forward to maybe seeing some familiar faces there too.
Thank you all.
Thank you.
Yes.
You said just what ᎠʰegyᎠ always says. She has something on her door of her office that says, "If you want to speak to my heart, speak in Cherokee."
It's beautiful. Thank you guys so much. I'm just really appreciative and filled with so much gratitude. So thank you, everyone.
Thank you.
I pray everyone has a good rest of your day and week. And I'll stop.